From social distancing to remote working and learning, it's a much different reality today than it was a year ago for so many people. Touro family medicine physician Dr. Meredith Maxwell is here to explain what we can do to take care of our mental health. Good morning, Doc.
Good morning.
All right, we talk a lot about physical health here. Why is mental health important?
Well, mental health can affect your physical health a lot. Like if you're anxious, it can give you high blood pressure, heart problems. Stress can lead to chronic medical illness. But I think the length of the pandemic, the social isolation is getting to a lot of people. They're like, when is this going to be over? I was hanging in there, and now it's too much. It's too much. So I'm seeing a lot of people struggling right now.
Okay, there are people who just seem cheerful all the time. No one can be cheerful all the time. It's not even appropriate. But when do you know that you're dealing with mental illness?
So when it's interfering with your daily activities, when you can't complete tasks, when you're not enjoying things as much as you once did, when you find yourself struggling with your interpersonal relationships more, when you find that your inner turmoil is affecting your daily life, it's time to reach out to somebody. And it doesn't have to be to your doctor, although that would be a good idea. It could be to your pastor or your minister, or there's a lot of employee assistance programs out there, that you can talk to. A lot of the therapists are on telehealth now. You don't even have to leave your office to talk to somebody. So I think if you're struggling, reach out, for a lot of those opportunities are out there.
We were joking during the commercial break about smartwatches and how sometimes they will, some of them will tell you to take a deep breath during the day. And they do that sometimes when you seem stressed out. I'm not sure they're picking up on that, but the point is that taking a deep breath, breathing, actually, stepping back and kind of taking it all in does make a difference.
It does. And, meditation and taking a couple minutes for yourself really does help. And I think a lot of us are way too busy to even take time for ourselves. But trying to do one new thing a day can help. Staying in touch with your family and friends. Laying off the alcohol, I'm seeing a lot of an uptick in that department, can help with the depression, anxiety piece, building a healthier routine.
Let me interrupt for a second. The alcohol
Sure.
aspect of this is interesting because a lot of people would say, oh, I get a nice drink and it relaxes me, and in general that's not really what the science tells us about the overall effect of alcohol and depression.
Sometimes you can see people self-medicating, drinking in order not to see the issues that are going on in their life. And when that happens, you see yourself drinking a little bit more and a little bit more and seeing that kind of trend. So really be aware of what you're doing, especially in this time where you're not really going out much. I'm seeing a lot of, drinking more, and just make sure you're just doing it for the right reasons, I think.
And then, as you pointed out, reach out for help if you're at a point where you think you need it. Dr. Meredith Maxwell, thank you as always.